President Donald Trump is making a major push to repeal Obamacare despite setbacks today on Capitol Hill. President Trump summoned Senate Republicans to the White House this afternoon after Majority Leader Mitch McConnell punted on the new health care bill. McConnell simply did not have enough Republican support to advance the bill before the 4th of July recess, though the president says Republicans need to act.
So we're going to talk and we're going to see what we can do. We're getting very close. But for the country, we have to have health care. And it can't be Obamacare, which is melting down. The other side is saying all sorts of things before they even knew what the bill was. This will be great if we get it done. And if we don't get it done, it's just going to be something that we're not going to like. And that's okay. And I understand that very well.
Let's bring in CBS News political director Steve Chaggaris from our Washington bureau. And if you listen closely there, Steve, to what the president said, he's almost opening a window, creating a scenario where this won't ultimately get passed, even though he has the senators at the White House to try and do some arm twisting. But this is happening on a day when yet more senators have come forward and said they cannot support this bill. It's up to 9 senators now. What can President Trump do?
Well, let's put it this way. If Mitch McConnell couldn't do anything leading up to this vote, I'm not sure how much the president's going to be able to do here. Mitch McConnell is considered somebody who, behind the scenes, can make things happen with members within his conference, and he was unable to get this to even close to 50 going into a potential vote this weekend, which is why he pulled the bill right now. So I think the president's really going to try to pep talk this up, but I'm not sure any of these senators who are on the fence or are saying no are going to really be swayed at this point. This is a bill that I think many Republicans, or at least more than enough, have problems with. And whatever the president says, I think it's really just more of a pep talk than anything else.
Senate Leader Mitch McConnell reportedly told his caucus that if they don't act on this piece of legislation now, essentially politically, Republicans will be forced to work with Democrats to fix Obamacare. Press Secretary Sarah Huckabee Sanders today said this was never really about a timeline, but you heard the president say Obamacare is melting down. So do Republicans need to move on this? And if they cannot achieve this by the 4th of July holiday or even shortly thereafter, what is the consequence?
Republicans have been talking about this death spiral, talking about the marketplaces, the Obamacare marketplaces, and pointing to places like Iowa and other states or counties in which the marketplaces are folding or collapsing. And they're saying that this is all going to collapse under its own weight. You've heard President Trump say that repeatedly on the campaign trail and since, that if you just let it go, Obamacare will collapse. Democrats are saying it's not that dire of a situation. This thing isn't going to, there is no death spiral. Yes, there are problems with the marketplaces, but it's not something we can't sit down and figure out. So when you talk about a timeline, it's hard to say if there's an actual expiration date on what happens here. Republicans, again, I think trying to amp up the urgency on this and really want to get their members moving forward in the same direction because they've been calling for the repeal of Obamacare for 7 years. And so this is one of the ways they amp it up. And so I think this is really an effort of the president and others to say, let's get this thing going. If we don't get this thing done now, then maybe we'll never get it done. And frankly, if they don't get it done now, I don't see how they get it done in a midterm year in 2018 or afterwards as you get into a presidential year.
Adding to their headwinds as well is this Congressional Budget Office report, which found that at least 22 million Americans will lose health insurance over the next decade as part of this program. The White House defending against that today by saying, well, the office is good at estimating budget, but not so much when it comes to estimating who will lose insurance. Is that a fair argument, or is this really the number that kills this bill's chances?
It makes a lot of people nervous. There's no question about that. This is the same exact scenario that we witnessed during the House debate on health care.
Right.
There was a number that came out. Originally, it was 24 million in the House bill, then they changed the bill up and it became 23 million. It was the same exact argument. You had Republicans who were supporting the bill saying the CBO is notoriously inaccurate, so why are we listening to these numbers? Ultimately, we saw what happened in the House. That bill passed because they made some other changes to the bill, which got enough people on board to get it passed by one vote. The question here is this. The margin of error for Republicans in the Senate is much less. 2 votes is all they can lose. They've lost more than that already at this point. Will this number basically scare too many Republicans into compromising elsewhere in the bill as they work on this over the coming week or weeks. That's the big question. We don't know. But right now, that's a number that had a lot of Republicans really worried after it came out yesterday, and I think is the real impetus for this bill not being put for a vote this week.
And this is essentially a dilemma for Republicans. I mean, Democrats are holding off on calling this delay a victory, but Senator Chuck Schumer is saying he's willing to work with Republicans to fix the current system, to fix Obamacare. Which is worse for vulnerable Republicans, to work with Democrats on fixing Obamacare or to pass this BCRA, the Better Care Reconciliation Act?
Well, we don't know the answer to that question. And you heard the Democrats saying, hey, look, we're willing to work with the Republicans. We're willing to sit down with them if there are 3 rules here. 1, no tax cuts for the wealthy, no rollback of this Medicaid expansion, and no repealing of Obamacare. Well, good luck getting a lot of Republicans to sit down with you if you're going to make those 3 rules. So I'm not sure sitting down with Democrats is going to be realistic, at least in the short term for Republicans. So Republicans are going to have to figure the question out. If they pass this thing, what does it mean for Republicans who are running for re-election next year, and what does it mean for the Republican majority? That's a question that's unanswerable right now. Democrats seem to think that if Republicans do pass Obamacare repeal and replace, that this is a winning issue for Democrats. And so I'm not sure you're actually going to see Democrats. I mean, I think short term, obviously, they're saying this is terrible for the country and it's terrible for people. But from a political standpoint, this is something they're going to use against Republicans from now until Election Day 2018. And they think they have an advantage on this issue.
And not to mention President Trump admitting over the weekend that he did call the original House version mean. You can see the Democratic attack ads essentially creating themselves. Never a slow day in Washington. Always good to have Steve Chaggaris to walk us through it all. And check out the Takeout podcast. New episodes out every Friday. Steve, thanks very much.
Thanks, Errol.